Hello my dear students. Today we are going to see how damage to cerebral cortical areas affect the language function. The damage to cerebral cortical areas concerned with language function can result in a disorder of language. Such disorder of language due to brain damage is called aphasia. The disorder of language may be observed as difficulty in speech, reading, writing and understanding. Aphasia is not dysarthria. Dysarthria is also a disorder of speech, but it occurs due to motor defects in the muscles involved in speech, that is, muscles of face, tongue and larynx. Whereas aphasia is the disorder of language function that results from brain damage. There can be different causes for brain damage leading to aphasia. Stroke can be a reason for brain damage, and if the damage occurs to the left cerebral hemisphere, it can impair language function leading to aphasia. Injury to brain due to accidents can also result in aphasia. Infections like meningitis and encephalitis and the subsequent inflammation of brain can be a cause for aphasia. Sometimes tumors can develop in or near the language cortical areas and result in aphasia. These are the different causes of aphasia. Aphasias are categorized into fluent and non-fluent aphasias. In fluent aphasia, the speech is fluent, but there is difficulty in comprehension or repetition of words, phrases or sentences spoken by other people. In non-fluent aphasia, the speech is limited and effortful, but there is fairly good comprehension of spoken speech. Different aphasias are Broca's aphasia, Wernicke's aphasia, conduction aphasia, global aphasia and transcortical aphasia. First, let us see about Broca's aphasia. As we have learned in the previous class, Broca's area is the anterior speech cortex and it is located inferior to the left prefrontal cortex. Broca's area is associated with grammar and speech production. Damage to Broca's area results in Broca's aphasia. Broca's aphasia is primarily expressive and non-fluent aphasia. The patient is finding difficulty in expressing his thoughts in words. Hence, his speech is not fluent. The speech will be slow, labored, disjointed and poorly articulated. There will be a lot of grammatical errors. The patient speaks very slowly using only the key words and a simple syntax which lacks function words like articles, prepositions, pronouns, auxiliary verbs, etc. Here look at this conversation. This Broca's aphasic patient was asked about a dental appointment. Look how he replies. The reply is effortful. The words are limited. Only keywords are present. The sentence is not grammatically correct since the functional words like prepositions, pronouns, etc. are missing. Still, the speech retains its meaningfulness because the keywords are there. The Broca's aphasic patients have good comprehension of both written and spoken language. Though the comprehension is normal, the patient is unable to understand long winding sentences with a complex structure. For example, sentences in passive voice may be difficult for them to understand. But the patient can understand simple sentences and has no difficulty in pointing out the grammatical errors in a simple sentence. Most of the Broca's aphasic patients also have agraphia, that is, inability to write. Here look at the writing style of a Broca's aphasic patient. You can see the sentences are poorly articulated, there are grammatical errors and also the capital letters and lowercase letters are used together in the words. These are the symptoms of Broca's aphasia. Now moving on to the next language disorder, Wernicke's aphasia. You know that Wernicke's area is the posterior speech cortex. It is located in the left temporal lobe just posterior to the primary auditory cortex in the left planum temporale. It is associated with language comprehension. Damage to Wernicke's area causes Wernicke's aphasia. Wernicke's aphasia is primarily receptive fluent aphasia. It is the inability to comprehend or understand words, but the speech is fluent and the person may speak a lot. They use words which lack meaning, but they have difficulty in comprehending the meaning of others' speech, and often they can't recognize their own grammatical errors. Look at this example. This is the conversation between a clinician and a Wernicke's aphasic patient. Look at the reply of the patient. He is speaking very fluently, but he is speaking long sentences that has no meaning. He is adding unnecessary words and he is even creating new words. Auditory comprehension is defective in Wernicke's aphasic patients because of the inability in distinguishing the phonemes of speech. Phonemes are the fundamental sounds that are combined to form morphemes. Morphemes are the smallest meaningful or functioning units in the composition of a word. Here, look at these words. Each word is composed of functioning units which are the morphemes. Each morpheme is formed by combining fundamental sounds called phonemes. The Wernicke's aphasic patients are unable to comprehend the words because they are not able to distinguish the phonemes in the word. The inability to comprehend the words result in a phenomenon called word deafness. The person is not deaf, but he is not able to comprehend or understand words. That is word deafness. Similarly, the Wernicke's aphasic patient suffers from word blindness. That is, visual comprehension or reading is affected. This is because the person is having inability to distinguish graphemes. Graphemes are the pictorial or written representations of a phoneme that combine to form a word. Look at this picture. How do you pronounce this word? Spoon. We know to pronounce this word as spoon, that is prolonging the sound oo, because of the two O letters in this word. That is the grapheme. Wernicke's aphasic patients have difficulty in distinguishing such graphemes and hence their visual comprehension is affected and reading is impaired. This is word blindness. Here you have more examples for graphemes and phonemes. The word blindness is associated with agraphia, that is impairment of writing. The speech of Wernicke's aphasic patient is fluent, but it is often associated with other features like anomia, neologism, paraphasia, and word salad. What is anomia? Anomia is the difficulty in finding an appropriate word to express a thought. When he finds difficulty in finding words, he may create new words or create new meanings for established words. This is neologism. Look at this picture. This person is thinking that he wants an apple. But what is he telling? He is creating new words. The next feature is paraphasia. That means substituting with other words. Paraphasias are syllables, words or phrases that are spoken completely unintentionally. For example, my mother instead of my wife. The person is talking about his wife, but unintentionally he is using the word my mother. Paraphasia can also be a distortion of the intended words. For example, line instead of line. He wants to tell the word line, but he is using the word in a distorted way as line. All the confusions associated with phonemes while speaking results in what is called word salad. That is, the Wernicke's aphasic patient speaks a lot, very fluently. He uses long sentences with new words, but the speech is meaningless. He can't even recognize the grammatical errors in his speech. and also he can't comprehend or understand what is being told to him. There are two minor variants of Wernicke's aphasia, an auditory form and a visual form. The auditory form is called pure word deafness. It is associated with impaired auditory comprehension. The person cannot repeat what is said or he cannot write what is dictated. That is the auditory form of Wernicke's aphasia. The visual form of Wernicke's aphasia results in dyslexia and agraphia. The person finds difficulty in reading and writing. Look at this picture. Two boys are stealing cookies. See how a Broca's aphasic patient and a Wernicke's aphasic patient describe the picture. The speech of Broca's aphasic patient is limited, non-fluent with only poor articulation. But still, it is meaningful since the keywords are present. But look at the description of Wernicke's aphasic patient. He is speaking a lot about the picture. But the speech is meaningless with new words and paraphasias, or it is actually a word salad. The next aphasia that we have to study is conduction aphasia. In conduction aphasia, the individuals can speak easily, name objects and understand speech, but they cannot repeat words. It is because of the disconnection between the thought of words in Wernicke's area and the production of words in Broca's area. You know that there is a white matter tract called arcuate fasciculus which conducts the neural representation of thoughts from Wernicke's area to Broca's area for speech production. In conduction aphasia, there is a disconnection between the thought of words in Wernicke's area and the production of words in Broca's area. It occurs as a result of the impairment of short-term memory. Because of that, the person is unable to repeat the words. That is conduction aphasia. The next aphasia is global aphasia. In global aphasia, the features of Broca's, Wernicke's and conduction aphasias are combined. Comprehension, speech and repetition are completely lost. Now moving on to the next aphasia, that is transcortical aphasia. Transcortical aphasia is caused by the defects in cortical areas outside the main language areas. You know that the main language areas are the Wernicke's area and Broca's area. Here, transcortical aphasia occurs as a result of the damage of brain cortical areas outside the Wernicke's area and Broca's area. Transcortical aphasia is characterized by the impairment of speech, comprehension and repetition. The impairment of speech, comprehension and repetition is variable depending on whether the area affected is nearer to Wernicke's area or Broca's area. If the affected area is nearer to Broca's area, then speech production will be affected. If it is nearer to Wernicke's area, then comprehension and repetition will be affected. With that, we finish the classes of this semester. Thank you.